and seeing if they're reproducing any type of numbness or tingling in their generally median nerve. Digital Allen's, one I put in here, if you remember Allen's test from back when we did this thing, is generally Allen's test are indicating a blood flow situation. It's a good test to do. It's not something we do a lot with. If they have a blood flow problem, they're not really supposed to be in therapy at that moment. You know, if they have some type of occluded or bad blood supply, that's not something we do a lot about. So, but it's a good little test to kind of see. So she's gonna pump her hands about 5 times. I'm just gonna find her ulnar and radial artery, keep going. And then when she's done, I'm gonna have her close it and keep it closed. I'm gonna occlude her radial and ulnar artery for just a handful of seconds here. And then she's gonna open up her hand and it's kind of white, and then I just let it loose and it just fills back in pink, and then I do the other side and it fills back in pink. I let one side go at a time. Doesn't matter, ulnar or radial. I might switch it around if I have a problem with that. The reason I let one side, there's a little bit of cross proliferation here, right? So if I let them both go at the same time, I might miss that one isn't really working that well. See what I'm saying? The radial nerve, radial artery could be getting a little bit more proliferation, and I just can't see this one little segment over here. So I let one loose, see that it kind of reddens back up with the other one. It's kind of like a capillary refill type of test that everyone's probably aware of or done before. That's digital Allen's test. Murphy's sign is pretty simple. It's a sign. So what that means is you make a fist like that, and your third finger should be higher than your other. If not, that means you've done something silly in your life, like punch a field or punch a locker or something like that. And subsequently, your third metacarpal has been pushed down and your lunate has been dislocated likely. Okay? So you have a positive Murphy sign if your third digit is not higher than all of your others when looking at it kind of in a horizon type of view. Okay? So it's really nothing we do. It's just look at. All right? Again, it could be certainly an anatomical abnormality. If I lifted my hand up like that and I never had done anything to my wrist or hand, and my thumb it's not anything I'm going to be excited about. It's going to be something I'm more excited about, like I said, if the player comes in and says, hey, I've just punched the locker because I, gave up a 3-run bomb right there to end that game, so that would be when we would kind of be looking for something along those lines. So trauma. All right? Varus and valgus stress test. All right, again, remember it's based on anatomical position. You don't have to have them in an anatomical position. I use my thumb as kind of the fulcrum to kind of bend it around. We're going to definitely use it a lot at the MP joint here. So what I would mean by that, I'm really trying to do the ulnar collateral ligament or medial collateral ligament. So I would stabilize, use my thumb as the fulcrum, so that's this right here, and I'm going to use my other finger to kind of pull it out to the side. We're checking laxity here. What you're trying to do as a therapist is get the infield. You can also do this in each of the digits up here. So again, I would stabilize. I would use my thumb as the fulcrum, and I'm going to use my other finger, and I'm going to say, okay, that's a valgus stress, or if I switch it around, that's a varus. So you're basically going in or out. There's a little bit of play in your fingers. What we're looking for is, does it go or way out? That means it's been dislocated or recently dislocated. So it's really kind of moving a lot. That's what we're looking for, okay, when we do that. So valgus or varus test. Valgus always test medial collateral ligaments or ulnar collateral ligaments if you want to use that term. Varus always test radial collateral ligaments or lateral collateral ligaments if you want to use that term, okay? So and you can do it basically at DIPs, PIPs, and MCPs of the thumb, okay, as well as IP of the thumb. All right, let's do those 5.